Good day, and thank you for the opportunity to present the exciting and important findings from our systematic review. What is the evidence for increased tone or overactivity of the pelvic floor muscles in pelvic health conditions? This study was supported by the National Health and Medical Research Council of Australia. Muscle tone is made up of some combination of active or myoelectric and passive or viscoelastic muscle properties. The contribution of these muscle properties to increase tone of the pelvic floor muscles has been considered to be involved in varying ways in a range of pelvic health conditions across four main categories: pain, bowel, urogenital, and sexual dysfunction or reproductive health. However, it is not well understood. Interpretation of the evidence for increased tone is challenging for a number of reasons. Multiple terms have been used to describe increased tone, and not all are synonymous. Most problematic is confusion due to terms that do not reflect the dual contribution of active and passive properties of tone. The small size, depth, and access to these muscles makes direct measurement difficult. Additionally, many measures investigate either one property of tone, for instance, EMG quantifying the active component, or cannot differentiate between active and passive components such as manometry or dynamometry. A large amount of literature uses subjective measures of tone such as digital palpation. Finally, many papers include participants with unclear or overlapping diagnoses, symptoms, and signs. The aim of the study was to systematically review the evidence for increased tone or overactivity of pelvic floor muscles in pelvic health conditions. We aim to assess method and measurement to address whether the study design enabled interpretation of overactivity, including study quality, study designs, and inclusion of comparison groups and data. We also address validity, accuracy of application, and accuracy of interpretation of measures used to assess tone. For outcome, we assess the overall evidence for overactivity of pelvic floor muscles in pelvic health complaints and whether there were any data to infer differences between age groups, sexes or genders, and pelvic health conditions. In terms of terminology, we aim to document the diversity and thematic grouping of terms used to describe increased pelvic floor muscle tone and consider the accuracy of application of terms. This was a systematic review with a narrative synthesis that followed PRISMA guidelines and was pre-registered on Prospero. Eligibility criteria were any papers that studied pelvic health conditions using a tool to measure muscle tone. Animal studies were excluded. PubMed, CINAHL, and Embase database searches were initially conducted in December of 2019 and updated in April of 2021. Papers were screened using covidence with multiple reviewers to ensure agreement. Data was extracted and papers were scored using a modified Robbins 1 assessment tool, and we created a separate outcome scoring tool to measure study outcomes before analysis. The study outcome scorecard was devised to fairly assess the outcomes of every measure in each study. A score of 1 was given if the study had a healthy comparison, a direct measure, or no application issues, a 0 if they did not meet this criteria. Additional notes were made if a tool had evidence of reliability or not, or if other outcome measures for that tool were used. A score of 3 meant the measure and its application met the minimum standard to provide convincing evidence. Once a base score was given, then the study outcomes were analyzed to determine if the study found increased tone, no difference, or decreased tone. Less than 3 meant the study did not meet the criteria and was considered to provide unconvincing evidence. Here are the PRISMA search results. 7,844 papers were identified, and ultimately 154 papers were included for data extraction. Of these, most studied pain conditions, and most used tools that are indirect combined measures of tone, such as digital palpation and ultrasound. Most papers used pre- and post-intervention outcomes as their comparison. 58% were cross-sectional studies. Adults and females were studied most frequently, and 149 terms were identified and categorized into 6 themes. From our original scoring system, unconvincing evidence was found in 215 measures in 137 papers. Convincing evidence was found in only 20 measures across 17 papers. Of the papers providing convincing evidence, 70% showed evidence of increased tone, and 79% of those are in pain conditions. But what are the characteristics of the convincing papers? Let's first take a look at those showing evidence of increased tone. 11 measures in 10 papers were used to study a pain condition, which included conditions related to the vestibule, chronic pelvic pain, of which only 1 studied men, vaginismus, and interstitial cystitis. Each has potential for pelvic floor muscle involvement and could also contribute to or be related conditions, highlighting potential for crossover in diagnoses. Only one study used dynamometry, and that particular study also used EMG. The remainder used EMG or manometry. All convincing measures in this case were taken at rest. Continuing with increased tone outcomes, two studied urogenital conditions. One looked at incontinence and or prolapse using dynamometry, and the other studied prolapse using shear wave elastography. The final convincing measure was for pregnancy-related complications that included mixed conditions and used EMG. Again, the most convincing outcome measure is taken at rest. The remainder showed no difference, primarily in pain conditions and a couple in the urogenital category. This time, however, two of the EMG measures were taken during voiding, which is consistent with the nature of the condition or where it is frequently tested in a urology clinic. The remainder used manometry. None of the outcomes showed decreased tone. In conclusion, this comprehensive review found few studies that provide convincing evidence for increased tone, primarily in pain conditions, and the majority of these studies use methods that preclude convincing interpretation. To advance evidence in this field, future work should consider inclusion of clearly defined control and comparison groups, use of validated outcome measures, and careful application of methods. Thank you to the University of Queensland and my advisors and contributors. I look forward to your questions, comments, and interactions online.